Thank you for the prompt. In this situation, we are looking to balance between increasing access while ensuring high quality care and understanding the scope of practice that comes alongside with it. To address this answer, I'm first going to talk about the need for policy like this. Afterwards, I'm going to talk about some of the pros, some of the cons of this policy, and then finally give my stance on the issue. Afterwards, I'm going to wrap up talking about why some of my personal opinions on this matter and a personal experience of mine that really relates to this policy, and why this kind of questions and understanding this policy is key for us to move forward in our future as a dentist. So, to talk about this issue beforehand, it's really important that we understand why policy like this is needed in the first place. The reason why we need policy like this is because many of our indigenous communities and those living in rural settings are lacking the easy access to dental care. They lack access to specialists, and this can cause long term issues in terms of overall oral health and other parts of health. And especially in these geographically isolated areas, they often deal with in higher rates of infections and cavities and things like that because of that poor access to care. And because of this, they're forced to travel and traverse large distances to be able to get care and get specialization and things like that. So when we look at this policy and we want to look at some of the pros and the proponents and why people want to push policy like this forward, as I previously mentioned, the first one is that we are able to easily increase the access and take care of those in our indigenous and our rural communities. And these are people who are historically have been neglected and abused. And when it comes to our relationship with our indigenous communities, for example, it's really a relationship that needs trust and it needs to be rebuilt up due to some of the historical mishaps that had happened in the past. Additionally, if we are able to increase access to things such as dental care, we know that there is a very strong correlation between our overall oral hygiene and oral health and the overall health of our entire body, entire system. And being able to increase preventative care when it comes to things such as that has been shown to help reduce the overall burden of other parts of the healthcare sector, and that if we can help reduce the influx of patients coming into already overwhelmed health clinics by increasing our ability to give them dental care, then that's a very large win for this. However, it's also important for us to address some of the cons of policy, of this specific policy, and why people may want to be pushing back against it. It's no secret that dental extractions are very complex maneuvers and very complex tasks that need to be done. And by allowing therapists, people who are normally used to cleaning teeth and things like that, the ability and increasing their scope of practice, we risk the harm, we risk the lowering of the overall quality of the work that we're supplying. The reason why quality is so important when it comes to dental practice or any kind of healthcare practice as a whole is because at the end of the day, our biggest stakeholder is our patient. And patient safety is really what matters the most. That's what should always come first in these kind of situations. By having these less experienced and less trained dentists going out and doing these kinds of maneuvers and tasks, they could indirectly or directly be affecting patient health, which could actually cause the issues that many people are facing in these environments to actually spiral and become significantly worse rather than becoming better from policy like this. This is why my proposition for this kind of policy would be to, yes, move forward with it, but on two caveats. And before I get into the caveats, actually, there was one more thing that I wanted to explain, and that one of the cons of having policy like this is that it could actually push general dentists and specialists away from these areas. Because if you're a general dentist, or you're a specialist for that matter, you would be less encouraged to go to areas like this if you already know that, oh, hey, there's already therapists over there doing that kind of work. And so one of the extra one of the extra cons of this policy is that it could actually push away more general dentists and specialists from these areas where they need more general dentists and specialists. And that's why, sorry, I wanted to accept this policy, but with two main caveats. The first caveat, obviously, would be that these therapists who are going out there and practicing have to do a some kind of certification or qualification that comes with in-depth and rigorous training. Quick, obviously, not very large long-term training, but relatively quick and straightforward training that after certification would prove that they have the ability to do these skills. That would, first of all, ensure that we are maintaining the quality that we need for this kind of care, but also balancing it with our patient safety. The second caveat I'd want to do is if we do plan on rolling out policy like this, I think additionally with the policy, we should add some kind of incentives for other dentists to join in on a program like this. For general dentists and specialists, things such as student loan forgiveness. If there are dentists who are struggling with student loans, that they may be able to come and practice in these clinics with these general therapists and not only help these therapists with these kind of processes and give them more experience, but also be able to treat patients themselves. And by having these incentives like higher reimbursement rates or student loan forgiveness and things like that, it would not only increase the quality of the training that the therapists get, but also increase the access that the patients get. And this kind of policy is really personal to me because I grew up in Lloydminster, Alberta, a city of less than 30,000 people. And I oftentimes remembered that if I ever wanted to get any kind of dental treatment done, that we were family would have to drive out, 4 to 6 hours to areas like Calgary or Edmonton to be able to get that treatment done. And that carries a long time burden. Obviously, that's not a short drive, but it's also a very large financial burden that comes from these kind of policies and these kind of actions like that. And so growing up and moving forward in my career as a dentist, it's reflecting on experiences like this that make me want to be able to give back to these communities of ours where we need more dentists and we need more specialists. And that's why after my career as a dentist, once I graduated and started practicing, I want to go back and practice in these rural areas, areas where our Indigenous community needs greater access. They need more specialists. They need more general dentists. This is a prompt, and this my personal experiences really remind me that it's our duty to give back to our community and that if we have been blessed with the opportunity that we want to and we should be giving back. Thank you very much, and I'd love to answer any follow-up questions.